High blood pressure or hypertension is a prevalent condition affecting millions of people worldwide. If untreated, it increases the risk of severe health complications, such as heart disease, stroke, and kidney damage, and why hypertension is known as the silent killer. While conventional medicines effectively manage hypertension, many people seek complementary approaches, including herbal remedies, to support cardiovascular health. We will look at some of the most researched and traditionally used herbal remedies for high blood pressure, their mechanisms of action, and how they can complement a holistic approach to managing the condition. Understanding high blood pressure. Hypertension occurs when the force of blood against arterial walls is consistently too high, which can strain the heart and blood vessels. Contributing factors include genetics, poor diet, obesity, stress, and sedentary lifestyles. Conventional treatments often involve antihypertensive medications like diuretics, ACE inhibitors, and calcium channel blockers. Herbal remedies can potentially reduce reliance on pharmaceuticals with your healthcare provider's guidance. Key herbal remedies for high blood pressure. Please note, this video is for educational purposes only and is not intended to diagnose, treat, or cure any ailment, illness, or disease. Hawthorn, Crataegus spp. Mechanism. Hawthorn has been used for centuries as a cardiovascular tonic. It contains flavonoids and oligomeric procyanidins that improve blood vessel elasticity, reduce arterial resistance, and enhance coronary blood flow. Hawthorn may also help relax the smooth muscles in the arterial walls. Usage: consumed as a tea, tincture, or supplement. Caution: can interact with medications like beta blockers or digoxin. Garlic, Allium sativum. Mechanism: allicin, the active compound in garlic, is known for its vasodilatory properties, which help relax blood vessels and lower blood pressure. It may also reduce cholesterol and prevent plaque buildup in arteries. Usage: fresh garlic, aged garlic extract, or supplements. Caution: high doses may increase bleeding risk in people on blood thinners. Olive leaf, Olea europaea. Mechanism: olive leaf extract contains oleuropein, which has been shown to lower systolic and diastolic blood pressure by reducing arterial stiffness and oxidative stress. Usage: typically consumed as an extract or tea. Caution: may lower blood sugar levels, requiring caution in diabetics. Hibiscus, Hibiscus sabdorifer. Mechanism: rich in anthocyanins and antioxidants, hibiscus helps lower blood pressure by acting as a natural ACE inhibitor and promoting diuresis, increased urine production. Usage: often brewed as a tart, refreshing tea. Caution: may lower blood pressure too much if combined with antihypertensive drugs. Celery seed, Apium graveolens. Mechanism: contains compounds like phthalides that help relax arterial walls and improve blood flow. Celery seed also has mild diuretic properties, aiding in the excretion of excess sodium. Usage: consumed as capsules, extracts, or added to dishes as a spice. Caution: avoid in cases of celery allergy. Ginger, Zingiber officinale. Mechanism: ginger improves circulation, relaxes blood vessels, and has anti-inflammatory properties that support overall cardiovascular health. Usage: used fresh in cooking, as a tea, or in supplement form. Caution: can interact with blood-thinning medications. Green tea, Camellia sinensis. Mechanism: contains catechins, powerful antioxidants that support endothelial function and reduce blood pressure. Green tea also has mild diuretic effects. Usage: brewed as tea or taken as an extract. Caution: contains caffeine, which may cause a temporary spike in blood pressure for some individuals. Turmeric, Curcuma longa. Mechanism: curcumin, the active compound in turmeric, has anti-inflammatory and antioxidant properties that support arterial health and improve blood vessel function. Usage: consumed as a spice, in golden milk, or as a supplement. Caution: high doses may cause stomach upset or interact with anticoagulants. Supporting lifestyle and herbal remedies. While herbal remedies can contribute to blood pressure management, they work best when combined with lifestyle changes. Diet. Focus on a heart-healthy diet like the DASH, dietary approaches to stop hypertension. Diet, emphasizing fruits, vegetables, whole grains, lean protein, and reduced sodium. Exercise. Regular physical activity, such as walking, swimming, or yoga, helps lower blood pressure and improve cardiovascular health. Stress management. Techniques like meditation, deep breathing, and Tai Chi can reduce stress-related hypertension. Weight management. Maintaining a healthy weight reduces strain on the heart and blood vessels. Precautions. When using herbal remedies, consult a healthcare provider. Always discuss herbal remedies with a healthcare professional, especially if you are pregnant, breastfeeding, or taking prescription medications. Monitor blood pressure. Regularly check your blood pressure to ensure it remains within a healthy range and to assess the effectiveness of herbal remedies. Be patient. Herbal remedies often take weeks to show measurable effects. Herbal remedies offer a natural and supportive approach to managing high blood pressure, providing additional benefits to overall cardiovascular health. Hawthorn, garlic, olive leaf, hibiscus, celery seed, ginger, green tea, and turmeric are among the most effective options, supported by both traditional use and modern research. However, they should not replace conventional treatments without professional guidance. Integrating these herbs into a holistic lifestyle plan can empower individuals to take control of their health and reduce the long-term risks associated with hypertension.